around everything that is happening at the minute. In light of that, we at CII IWN wanted to bring you something that would be a value add, both for you at the current moment, for your families, for you as a way of just understanding the situation, learning how to handle it and deal with it at home. We are all going through our own issues at the minute. So we just need to make sure that we are able to handle ourselves, handle our families, be the support that we need to be for ourselves and everybody who's depending on us. And with that, I have Dr. Glossy Sabharwal. She is a leading radiologist with Apollo and Jeevanmala Hospital. And Dr. Glossy, a very, very warm welcome to you today. Dr. Glossy, could I request you to please unmute?
Can you see me and hear me well? Am I audible?
Yes, you're audible, Dr. Glossy.
Thank you so much, CII IWN, for organizing the meeting, the need of the hour. We are all definitely not in a happy space. I wish I could say it's a pleasure to be here answering these questions, but the fact remains that it's not. I am honored that CII has trusted the work that we have been doing, and I'm here to answer your questions. I will be more than happy if you can ask whatever question COVID related you have in your mind, you put it across. We'll be there to assist you, to guide you, to help you. The times are tough, and in whatever possible way we can help, we are there. Thank you so much, Bhavna, for organizing. And
wonderful, Glossy. Thank you so much for being with us. So this is meant to be a real participation and interactive call. As we start with getting our questions, I wanted to just start off with 2-3 of my own first. So I'm just going to dive in there. So the very first thing that comes to my mind, Glossy, is what do I do if I start feeling unwell?
So without wasting further time, let's quickly answer the questions. Now, if I am here and I am feeling unwell, or any member in my family is feeling unwell, now this feeling of being unwell can be anything. The earlier 2020 COVID gave us very characteristic features of fever, dry cough, weakness, malaise. But this strain, whether you call it Indian strain, UK strain, or whatever strain, this COVID in particular has caused a very different symptom altogether, all the symptoms. Mostly people have started coming up with, it has affected the younger age group more. And people have started coming with diarrhea, with most of gastrointestinal symptoms, with as simple as acidity. So the feeling of you being unwell, what do? The first thing you do is isolate yourself. I will give you 5 pointers. We all remember the point system. I give you the 5 pointers. First thing, you isolate yourself. Second thing, you do not panic. Because if you are going to panic, that is going to affect your body and your parameters. Mind controls our body, we all know that. But it can be seen also, and in our recordings, whether we are taking fever, whether we are taking pulse oximetry, we have to make sure that we are not in a panic mode. We'll start gasping for air because we are scared of COVID. We all are. Subconsciously, our mind has been really tortured by all of this. So we don't want to let that thing take over. So first we isolate. Second, we do not panic. Third thing that we do, we just sit down and take our fever. Because fever has been the most consistent feature that has been coming, even if it's a 99 fever. Then after fever, we are going to then check our pulse oximeter. When we are checking the pulse oximeter reading, you have to make sure that A, there is no cream on your hand. B, there is no nail paint. C, your hand is very relaxed and you are comfortably sitting, and so is your mind relaxed. If you are in a panic stage, you'll gasp, your pulse rate will go high, your oxygen will start getting, reading of 94, you gasping, thinking that, what has happened. So all this will affect, which we do not want. So we
Yeah.
take fourth thing, we take our pulse oximeter, and
Okay.
fifth thing, we call the doctor. We are comfortably sitting, we have isolated ourselves, we have taken all the precautions, we are not panicking, we have taken our fever. So 5 things are that we are going to do if we are feeling unwell or anybody in the family is feeling unwell. Isolate,
Okay.
that's the first thing to do. Yes, please.
Yeah, no, so I'm just going to recap them quickly for everybody. If I've got it, one is isolate, second is don't panic, third is pulse oximeter,
Yes.
fourth is
Fever,
yeah,
we
check
take
your
fever,
fever, and the fifth is
we call the doctor.
call your doctor. Okay, so
Yes.
I hope everybody's captured that. So that's what you do if you start feeling.
Or any of your family members starts feeling unwell.
Okay, and what about if we're not able to call a doctor or we can't reach a doctor? Then what do we do?
Now, unfortunately, in this scenario, because maybe we were not anticipating COVID to hit our country so bad, so the healthcare has not been prepared to face such a pandemic. There is shortage of doctors. Doctors are overworked. Labs are overworked. We all have to understand that you might have this symptom middle of the night. You might start feeling unwell later during the day, and the doctor is not available. Now, what do we do? This is very, very important that you are doing those 5 things and you are sitting, you're trying to call the doctor is not there. Now what do? We don't panic.
Yeah.
Now, according to our parameters, what we are getting, for example, my fever is 99. Okay, what do I do in fever? What do you normally do in fever? You take Crocin.
Oh, so
Right?
yeah.
Even if you have diabetes, even if you have thyroid, it is safe for everyone. Over the age of 16 years, 14 years, 16 years, we know that this is a safe medicine. We take paracetamol, we keep Crocin at home at all times. What will happen? Your fever might not break because this COVID fever is not breaking with only Crocin. You take it every 4 hours or 6 hours. You can safely take it. Don't panic and take your multivitamins which you are supposed to take. At least having a set protocol at home will make you and your family much at ease versus somebody who's not prepared and trying to call the doctor and doctor is not there and I'm panicking and the whole family has panicked. So your set protocol, which I will share it with the CII and we can discuss it, we can share it with you guys, that keeping that one stock of medicines at home is no harm. I don't call it that you are, hoarding medicines for yourself. This is not, you are not taking anybody else's medicine, but keeping a set is important, at least one set, so that if there is, there's a problem,
An issue. Yeah. Okay. So Dr. Grassi, can we have 2 things from you? One, what are the generic vitamins or things that we need to take? And then second, can you go over what are the medicines, not from a hoarding perspective, but one set that we need to have? What would they include?
Okay, so first
Vitamins,
question, the vitamins that we need to have at home, at least one set. Okay, you will not take it, otherwise you are well, please don't take it. But if you are feeling unwell, now this question is revolving around you feeling unwell.
Yeah.
One thing, you're going to keep zinc. We all know Zincovate, 50 mg zinc, Zinconia, whatever brand you get. So we take zinc at home. We are keeping vitamin C at home, 500 mg tablets. We are keeping vitamin D at home. We are keeping vitamin E at home. So these 4 you are going to keep plus Crocin 5. These are 5 generic medicines, over-the-counter multivitamins, supplements and drugs which can be taken by anybody safely. So these 5 medicines must be kept in a small box in the house. This is our emergency kit, and with that you must also keep a thermometer and a pulse oximeter. So any person who's feeling unwell picks up that dabba and goes inside, and we know that that person is isolating.
Yeah.
Whether it is 18-year-old child or whether it is 50-year-old mother. Protocol has to be same and no panic. Everything will be fine. The second question was
wonderful. I like that. No panic. That's the most inspiring thing. So yeah, and now just one question before we move into those medicines. This, the zinc, etc., and of course what you need, SOS. Is that something that everybody can take, or just if you start feeling unwell?
If you start feeling unwell.
Okay.
Don't a lot of times we have seen that there is hypervitaminosis happening in November, December last year, 2020. It was seen that people took so much of vitamin D that especially in young children, they started getting hypervitaminosis, which is not a good condition. So we should not take it if we are feeling otherwise fine.
Okay, fine. And now could you come to what the set would be if you start feeling unwell and you can't reach a doctor?
So one set which is something that you need to keep it at home, but not take it unless there is a specific feeling unwell and you are isolating yourself. You've taken all these 5 things, your vitamins and crocin. Those medicines you're going to keep at home so that in case your doctor is available and he tells you, okay, these are the medicines, please take it. Okay, so you take those medicines. Or apart from that, if the doctor is not available and you know that your fever is 100, you have the symptoms, you were exposed to COVID positive patient any time around this and you have a high probability, then you can take those medicines. Those 3 medicines are ivermectin number 1, azithromycin number 2, and doxycycline number 3. Now, having said that, keeping these medicines and taking these medicines should not be done like, okay, it's my anxiety, I've got 99 fever, I'm going to take it. I forget that I am allergic to doxycycline.
Absolutely.
You need to know that. Right? So your allergies need to... So these 3 medicines have to be kept in a separate box. Only and only in dire emergency, or when your doctor or any doctor friend of yours tell you that this is the prescription you need to follow, okay, I have these medicines in the house. I don't have to start calling the medical stores, chemist and all. It's lockdown time, hardly people are available. So we have the medicines at home.
Okay, fine, got it. So you're basically saying keep these 3. Obviously consider your own symptoms. Obviously consider whether you have any allergies. So let's not, this is a generic prescription, but obviously has to be customized. And first rule of thumb is try and connect with your doc.
Absolutely.
And this is what you need to do. Okay. Before we start, and we've got a lot of questions coming in, I have one which I'm going to ask you. Everybody is saying COVID is so deadly, COVID is so deadly. And I think COVID is so deadly. I think COVID can be okay. But I think at least what I'm hearing, the reports, everybody seems to be talking about the oxygen not being available at the right time. So can you tell us, really, how do we train ourselves in such a manner that we don't need to reach that stage of requiring oxygen? Is there anything that we can do for ourselves? Because that is the fear. That fear that I'm not going to get a bed, I'm not going to get an oxygen in time. And really, I just want to know, how can we not even get to that stage? Is there anything we can do to stop that?
Now, this is exactly, Bhavna, what is happening. And I've been telling every single person, patient calling me, that the disease has got 3 stages if we talk about it. There is a mild stage, there is a moderate stage, and then there is a severe stage. You will be in a transition of either mild to moderate or moderate to severe or severe. Now, when we say that our oxygen has dropped, that means it did not drop from 98 all the way to 90 in like 2 minutes. Body gave you symptoms and time to act. So early action and complete action is most important. What is COVID doing? What is happening basically? That we know that in our respiratory system, there are very thin cells which are called the alveoli in the lungs. Those alveoli have blood vessels going through them like that. So those blood vessels will pick up oxygen from the alveoli that we are breathing. Now what is happening? The membranes here the virus is causing all thickening. So oxygen is not able to go from the lungs alveoli into the blood. So your oxygen is going down, but it does not happen in 2 minutes. It does not happen in 5 minutes. It happens only when 94 to 90 or 90 to 89 or 89 to 80 will happen in 2 minutes. But 98 or 99 to 93, 92, 91 will not happen in 2 minutes.
Okay.
There we need to understand that early recognition that you are feeling unwell. What happens? First thing that comes is in human mind, denial. I don't have it. This happens every year to me. I don't have it. Why are you saying that I have COVID? Right? So you don't want to accept it. You are sitting there across the table having dinner with your family. You have exposed everybody. Who wants to go in the room and sit alone and have dinner or be isolated? Nobody wants. And that is what is happening, Bhavna, which people need to understand. We have reached this stage. And we all are reaching in the stage where ambulances are standing outside my own hospital and I'm not able to take the patients inside. They're gasping for oxygen.
Yeah, that's the fear. Actually, that's really the fear.
If we want to avoid that, we have to be very smart, very crisp in our think. Okay, I'm feeling unwell. My family member is feeling unwell. Please go inside, lock yourself up, have these medicines, follow the protocol, and we do video calls. We be happy. It's okay. We'll go through this smoothly, and patients are recovering beautifully.
Yeah. So the protocol that to not get to that stage is basically, what are the things that you would like to leave people with here?
So again, your isolation, your early set of medicines, your consultation with your doctor, and your diagnosis has to be early. Even if your test is not coming or whatever, you have to diagnose yourself early, and then your treatment has to be early and complete. We are coming from that mindset where we have been taught that avoid medicines and have naturopathy. Have haldi, have nimbu pani. Why do you want to have vitamin C? Have amla. That's what mothers have taught us. But now in pandemic like this, where the virus is very intelligent and muting, we have to be proactive. We have to push our bodies forward with that.
Yeah. Okay, great. So basically the takeaway here is isolate and make sure that you are getting your treatment in a timely fashion. Don't wait it out. Medicate until get the treatment going as soon as you can, and do it completely. Those are my takeaways. Okay, wonderful. So I'm just going to start because we've got a number of questions. The first question is, when do we need a CT scan? Which day?
Okay, now being a radiologist working in COVID, I can exactly tell you what is happening because I've been doing this for a year and a half now, since the time COVID first started. The best time to get a CT scan is, number one, if you are, you know that you are feeling unwell, you have got fever, you had exposure to COVID patient, your RT-PCR is coming negative, or you are having cough and you are having fever and it's not the usual thing, you're not being able to diagnose, you're not being able to take medicines, what do? You get a CT scan done. Your CT will pick up the lesions that are very specific to viral pneumonitis equivalent to COVID-19. Second thing, when do you need to get a CT? If your RT-PCR is positive, then on the 5th, 6th, 7th day. And then suppose your 5th, 6th, 7th day is totally smooth, no cough. Wait for some time. Your pulse oximeter is fine, no harm done. Second week of COVID is something where you have to be more careful, and that's the time when we get a CT scan done. So either
why is that this time, second week?
It's COVID does give you time to adjust. It tells you have your medicines on time and I won't harm you the first week. What happens first week? Nothing happens much and we are very happy. Oh, COVID is just a facade. There is nothing happening. Look at me. I'm totally fine. But at that time, your lungs are getting affected.
Yeah.
And it takes time. It has that much of incubation period to actually come out. And when it comes out, then what is happening is air hunger.
What is happening is
the air hunger, lack of oxygen, because we are not able to help them, So.
Okay, right. So, and the CT that you're talking about is the HRCT, or is it
Yes, it is called the HRCT, high resolution CT scan of the chest, and that is what should be done. It's a 2-minute scan that happens and gives you excellent information. Because the machines are so good these days, radiation is not a concern at all.
And all these people who think an X-ray is fine, is it fine?
Please, I really want to emphasize with folded hands, don't send me pictures of x-rays saying that my x-ray is fine, doctor, I am COVID positive. X-ray will not pick up those opacities, will not be able to guide you. It's a misleader. X-ray in COVID, what happens? We all have seen ground glass. We know how ground glass looks like. We call them ground glass opacities. Now, ground glass opacities are not seen on X-ray at all. I report so many X-rays daily and I report so many CT scans daily. Same patients who have come with a CT scan with X-ray. So I have been doing this since the time COVID first started in 2020, March. And the inference is that X-ray is normal. X-ray will show only when the things have gone to the severe stage or to the moderate stage. We are not going to, our aim should be, we are going to control the disease in the mild stage, not let the moderate and severe happen.
Okay, great. Thank you, Glossy. Now we've got another question. What should the protocol be for the rest of the family members if they have a positive patient in their house?
Now, one is that the patient is positive, is RT-PCR positive, symptomatic, isolation. Keep one room for that person that has good ventilation. Okay, so dedicate in your mind, everybody in your house, you will recognize that these are the rooms. We have got 2 rooms, or if there is one big room, okay, there's this room that has good ventilation, that has a TV in it, that has computer in it. You know, that person is alone inside. That person needs to be really happy about it. That, you know, this is my relaxing period now. Next 10, 12, 14 days, I am going to be relaxing. So you look forward to going inside. Okay, fine. It is my room. So keep one room in your house. And then comes the nutrition part. How do you feed? Disposables are the best to use because they are easy to discard also. And do not touch anything. Then make sure that other family members are very vigilant for the symptoms, but not in a panic stage. So they have to be vigilant. What if the second person also develops symptoms? Usually what happens, first person developing symptoms to second family member developing symptoms is a period of 5 to 7 days.
But staggered.
Yeah, so it's like you get that buffer. Keep 2 rooms ready. Keep 3 rooms ready. Why not, right? Whatever we have, maybe we have a drawing room, we can convert that into one place. And that is what it should be. Isolation with good nutrition, with everything ready, with separate thermometer, separate pulse oximeter. Nothing has to be in the, no exchange has to happen between the person who's isolated and the rest of the family members. The person who's isolated should try and do their own things, cleaning of the room, washing their clothes, washing their utensils inside. You can give them in disposable and they can put them inside themselves and make it a nice, happy, cheerful time for them. It's okay. Things are going to be sorted that way.
So that's wonderful. So just to recap, so if somebody has tested positive and you have to isolate them, you have to make sure that they are on their own and stay away. But how do you protect yourself? And if 2 people test positive, the one who started then and the second person tests on 7, like you said, it's staggered, then does that person move in with that person?
No.
Then what do we do?
No, we isolate them separately because the person who's on day 7th will be out and recovered on day 10th, 11th, 12th, while the person who's on day 1st is at a highly contagious stage and should never be in the same room. 2 separate rooms, yeah.
Okay, and all right. How soon after receiving a COVID negative report are we prone to a reinfection?
You're prone to a reinfection. Usually what we have seen is that after, 2 type of people that I have seen have not come yet to me except 2 cases is those who have had COVID before in 2020 and have been vaccinated with 2 doses, and it's been like more than 40-45 days. So those are not getting affected, turning positive, COVID positive with symptoms. But the people who are turning positive, it's a high frequency. They are coming, all patients, those who had COVID before, but the COVID is pretty mild, so they don't have to worry much about it. Third thing is that if you have been vaccinated, right, that was the question, or you have been tested negative. Okay, you've been tested negative, now till what time are you? See, COVID can happen any time after 4, 8, 6 weeks. It's not like that. How do you know that you have tested negative? Even the RT-PCR is not 100% reliable test. Sometimes on day 14th also it will come positive. Sometimes on day 7th also it will come negative. And why is this happening? Especially in this particular virus, because of the nasal swab that we are taking, or the throat swab that we are taking. The way it is taken is important, and the lab that is testing it, that is important. Every lab, I'm not saying here that the labs are not doing a fab job, they are doing a fab job, but they are overstretched. So the false negatives are also high. If you're positive, but the false negatives are very high. So if you have tested negative, you have to observe for your symptoms, and you have to still maintain your social distancing. You have to still wear a mask. You have to still observe yourself for everything. Although your antibodies will form within 4 weeks time, but still you need to take all the precautions. You cannot be sitting over it. Okay, I had COVID, I cannot. Maybe you don't have it, but you still can spread it.
Okay, thank you. So for a recently recovered COVID-19 patient, what precautions can they take? What assists in post-COVID recovery process?
Okay, so when you are recovering, you will continue taking those 4 vitamins that we discussed initially in the beginning: vitamin C, E, D, and zinc, those multivitamins and supplements. Also, you will try and increase your natural protein intake and your hydration. Most important is that the distaste that is happening, the gastrointestinal symptoms are happening in COVID. Many times patients are coming up with stomachache later also, and the distaste. They don't feel like eating. The appetite has gone. Patients have lost weight also. So you need to keep your nutrition very high. There is nothing specific in that it is a COVID food that you have to take. Take a high nutrition. If you are a vegetarian, you can take broccoli, you can take soya, you can take green peas. They have high protein. You can take rajma. All of these things, are lentils. They have high protein. In non-vegetarian, there are ample options of high proteins. Clear chicken stock, having it daily. So keep your protein intake high. Like in any other virus, like we have seasonal viral. So you have to take that. But yes, hydration is another thing which needs to be emphasized on.
Okay. How important is it to take azithromycin along with doxy? Doctor has not advised azithromycin. Should we still take it?
Okay. Now, as I told you, there are set protocols that these medicines are safe. Every doctor has their own. See, COVID is very new. So are the doctors who are treating them into this, right? Some doctors will feel that I have treated 100 patients or 200 patients with only doxycycline and all these vitamins and my protocol, I am going to give this. That is perfectly fine. Some doctors say, no, I want to go all balls in. I want to give 2 antibiotics. I want to give ivermectin. I want to give all the multivitamins. I want to go all balls in, depending on your comorbidity. So if you are at a higher risk versus you are at a lower risk, the doctor will tweak it. So trust your doctor. Most important. Don't do, many times, Bhavna, what I'm seeing, one doctor prescription is getting checked by another. That's not the right way. Each doctor has spent his or her 5.5 years in MBBS and 3.5 years in MD. And trust me, it's not easy.
Absolutely.
They are right there updating their knowledge every now and then.
And I think if you keep comparing your doctors, and a second opinion definitely has value, but if you're just going to keep second guessing your doctor,
second opinion in some cases where yes, you have a problem, your patient is not recovering, you need a second opinion. Why not?
You need a second opinion, absolutely.
Yeah.
Okay, the next question. what's the effect of COVID on pregnant women? What should they do?
So far, pregnancy has been smooth. We have in 2020, it was very smooth. We never saw a case which was COVID positive getting affected the baby, getting affected with the COVID positive mother. Mother recovered. We delivered COVID positive babies also. Mothers are COVID positive and good delivery happening. So that is all okay. There was nothing. But this strain in particular has given us, although the research and the time span is very small, but we have seen, little more complications happening, few miscarriages happening in COVID. But at the same time, there's nothing to push your panic button on. Even if you are pregnant and you get COVID, relax. You're going to follow the same things and totally be focused toward treating your disease early rather than denial and getting into a condition where we cannot help.
Okay. Then I've got my RT-PCR negative twice. Antigen negative. I have no other symptoms except anxiety. Last few days, I have low-grade fever. I'm taking homeopathy. My oximeter reading is normal. Not enough. What good is it doing? Sorry, what? I can't read that. Just show me what this is. I mean, what good is it doing, or is it good enough, or can you guide for something else?
All right. So what I've understood is your RT-PCR twice is negative, your rapid antigen is negative, and you have no symptoms whatsoever. Now you have started developing fever, right?
Yes. Yeah.
First thing is that again, you are developing fever. We are in a pandemic stage. What do? We do those first 5 things what we did. We are going to isolate ourselves. We are going to keep a record of our pulse oximeter and the fever. The minute you develop fever, you are going to isolate yourself. And then after that, you will see, you are getting what is happening these days. Why is RT-PCR coming out negative? Apart from the virus being mutant, what is happening is that we are getting RT-PCR way before. We need to get it done when we are actually having symptoms. 9900 fever. Let it be. Let your body come out with it. Then the viral you check. Then it turns out positive.
So it's almost like let it germinate first.
It has to, we have to test it somehow. Second thing, if you are also having cough with it, maybe a mild cough, maybe you think it's a seasonal cough, check that also. If you have that, then you go for HRCT chest. Even if your COVID is coming negative, I've got ample patients that we have started with all the medicines and they have recovered beautifully well, touch wood, everybody is doing well. Those who had RT-PCR negative but were feeling little uneasy in the chest, on and off fever not coming or not going, just not feeling well, did the CT scan and it was right there.
Right. Okay. Can I request everybody to please mute themselves? Thank you so much. Okay, now it says, my mother is not positive. She has recovered, but she's still not recovering. She's feeling extremely weak and badly bloated and barely able to eat.
What is it? She was COVID positive or no?
It doesn't say.
Was she COVID positive and on her recovery stage, or okay? It matters that if she was COVID positive and she has taken her medicines and she's otherwise doing well and it's post-COVID, then this is happening quite frequently, especially in elderly and those who have comorbidities. You have to make sure their nutrition is well. If they are not able to eat, then it's always better to give them IV drip to get that organized at home and give them IV fluids and nutrition. Do not wait for the time when things become bad to us. We do not want that.
Right. Okay, so RT-PCR is taking 3 days to take place, and then result is taking another 72 hours. What should one do by then? So is it almost that you take RT-PCR or HT depending on if you're feeling well or not? Which one is your go-to then?
So according to me, the go-to thing here is you, yourself and your symptoms.
Okay.
You are isolating. You have started your medicines. You have given your RT-PCR, you are observing yourself. These medicines are not going to cause any harm to you. They are very safe and tried and tested drugs. Your RT-PCR turns out negative. Still, because your symptoms persist, you wait and be in isolation for at least 7 days. That is very important, because if you are going to say mera to RT-PCR negative aa gaya, let me go inside and meet the family members and hug them, third day one of them or you will have fever again, and then the pandemic starts. This is what is happening.
Okay. So even if no one, if there are no symptoms, will people have loss of taste or smell?
Loss of smell is a very specific symptom of COVID, which was more common in 2020 strain, but it's still there.
Okay.
It's a very specific symptom, yeah.
Okay. My doctor started steroids, 40 mg. Besides Augmentin, 625 thrice a day. I am doing it, but I don't know if this is fine or not.
A doctor starting steroid. Are you COVID positive, or were you COVID positive before or at any point? That is my question number one.
Can I just read the whole thing for you? It's very, so my doctor started steroids 40 mg twice a day, besides Augmentin 625 3 times a day. I am doing it, but I don't know if this is fine or not. I have a cough and CT report says 6 on 25 score. My fever is 98.3.
Okay. Okay, so that means since your CT has confirmed that you have COVID, that is happening. Now, my little contention here would be that Augmentin is usually not the medicine that we give in particular in COVID. The antibiotics that we are using are doxycycline, azithromycin, but some doctors have, you must be having some other complaints due to which your doctor has put Augmentin. So that is your discussion with the doctor, that okay, listen, you have put this. Is this something that is for something specific in it? Because that is there, one thing. Secondly, adding of steroid. Steroid is, Bhavna, steroid is called a wonder drug, and I am in love with it, because any patient having any sort of inflammation, steroid tries to reduce that inflammation and tries to give you a feel good factor, which is very important in this time. So steroid is given. Now, giving of steroid depends on your condition, your body weight, and what is the problem that you are having. I'm sure if your doctor has suggested steroid, there has to be some other reason, because if we are talking about a CT score of 6 by 25, which falls in a category of mild, then we do not put steroids in a patient unless there is some other associated condition or a comorbidity. So definitely there is more to your condition than only this that you have written.
Okay. Thank you for that. So if the test keeps coming negative, then when do I get a CT scan? What date?
It depends what are your symptoms. If you do not have any symptoms, you are asymptomatic, or maybe you had fever for 3-4 days and now you don't have, and your RT-PCR is coming negative, you isolate yourself for 7 days at least with those multivitamins and observe yourself. If you do not get any symptoms for at least 7 to 10 days, depending on how are other members in your family. Are you staying alone? Are you having other family members? The other family members must recognize their comorbidities. You have mother and father who have diabetes, had cardiac surgery, have kidney issues. You need to be inside your isolation for 10 days. You are living alone, there is no problem, maybe you have a child, or it's okay, 7 days observe yourself. So it matters from symptom to symptom, person to person. HRCT test is only when you have symptoms, okay, and your test is coming negative.
Negative. Got it. Is this variant airborne? Does this mean if we are sitting in our own home balconies, we should wear a mask?
There is a lot of research happening, but it's too early to say. But yes, I have got patients who have not stepped out of their houses and got positive. Somebody who has been sitting at a distance in the house, maintaining that, at one corner, and the other person in the other corner, and still getting affected. So whether it is airborne or not is still a debate. Okay. There is a research going on. We cannot be confident about it right now.
So if people are maintaining 6 feet, then they can, they don't have to, should they?
Earlier, Bhavna, in 2020, it was coughing causing it, so we masked it up. That you have to wear a mask. In the house, nobody is wearing a mask. You're sitting across, you're talking, you're not coughing, but you're still
Okay.
spreading.
But you're still spreading.
You're still
Should one have Pantocid daily if positive?
it's better because the number of medicines that you're going to take for COVID, there are antibiotics, so it's better to take an antacid with it. But there are a lot of better antacids than Pantocid and Pan 40, I feel. There are better versions of antacids.
What's a good one that you would suggest?
I don't want to put a brand name here, but there are other salts that you can give. Rabiprazole is a better salt, and there are other salts. If as a doctor, I don't promote a brand, so it's important that there are new antacids which have come. So I always tell them that it's better to shift from Pantocid.
Okay. What should be good amount after COVID where we are no risk to, so what, basically how much antibiotics should we take such that we are not at risk to get COVID again is some question.
You cannot. I wish I could answer this, and in a positive way, I could answer that take it for 5 days, take it for 7 days, Bhavna. We will not have COVID. I would have given it to anybody and everybody in the house also, and in my hospital also, that I would have said, take everybody for 5 days, you're not going to have COVID. But unfortunately, this is not the fact. So there is
Okay.
no such thing. You take it for 7 days or something.
Okay. These days, the RT-PCR report is taking forever to come. Are there any other blood tests, or we've already discussed the CT? Are there blood tests that can confirm COVID? And
There are no please understand, there are no blood tests to confirm that you have COVID. Please do not get your blood tests done. What is happening is your first 2-3 days you've got fever, सबसे पहले D-dimer, IL-6, CRP. Quickly patients are giving their samples and getting it done.
yeah,
Why? Your D-dimer, if it has to go haywire, your IL-6, if it has to go haywire, will go after 5th, 6th, 7th, 8th day. That is the time where we have to do. What is happening? What is the side effect of this? That people are overburdening the labs.
labs.
So people who actually need the tests, we are not able to test them. Where we have to put Clexin and anticoagulants, we are not able to put that blood thinner because the labs are being overworked by these people. That you are sitting and you are like, no blood test can confirm COVID. Only RT-PCR, if that is coming negative, it is your symptoms, and then HRCT chest, which confirms typical type of viral pneumonitis, which is seen in COVID pneumonia and no other, in a pandemic especially, it is not seen otherwise. So that confirms. There is no other test as of now, your blood test. All these tests have to be done on 5th, 6th, 7th day, depending on the symptoms, not on the 1st or 2nd day. So please don't rush into getting your tests done.
Okay. And I think one thing you said was that we need to be aware, go into day 5, day 6, day 7, and then start doing your CT, because even your RT-PCR may come negative, right?
Unless you start with a cough.
Okay,
Suppose every person has their own way of tackling a problem. For example, I have headache. Maybe it is 2 to 10 and I start screaming and panicking, and vice versa, my husband would feel it. He will only panic when it's 10 on 10. So maybe you ignored the initial symptoms and you only noticed when you had cough. So if cough and an annoying cough is your presenting symptom, then CT has to be done immediately. Then we don't wait.
Okay. Does the virus cause permanent life-changing damages of some sort to each person infected, irrespective of whether the patient was mild or moderate or severe? So is there any sort of, life-changing damages that we are aware of now?
See, COVID has affected all of us in many ways, and we have seen that. And we have discussed that many times, Bhavna, that it has affected the mental state a lot. There is mental clouding happening. There are a lot of stress-related changes happening in the body. Diabetes has gone a little up in patients who were diabetic because of the steroids being given. So the management of things have changed. Now, if we say that life-changing things, yes, it will. We will never be the same as we were, but I feel that we'll be wiser. we'll take care of ourselves in a better way. It does cause scarring of the lungs, which we have seen on CT scan again, that it causes patients who have had COVID in 2020 and are feeling unwell, or their CT is being repeated now, that there are these band opacities that we see. That means that the lungs have got scarred. But at the same time, it's our body. We will fight it out. We do lung exercises. We do respirometers. We do blowing of balloons, which is a very good lung exercise. Keep your lungs as strong as possible. No smoking. And all of this will help.
Okay. Thank you, Glossy. What if by the 5th day of COVID, you are fine, no symptoms? Can the second week be reversed? As you said, COVID seeps in second week.
So if you are doing well in your first week, you need to make sure you are following complete treatment. Complete treatment is very important. There are a lot of medicines which you'll have to eat. But usually what is happening is that you are either self-medicating or combining two doctors' prescriptions, or not taking the medicines as they are given to you. And apart from that, you have to observe yourself. The pulse oximeter, the fever, the nutrition, the vitamins, the hydration, everything has to be kept on top. And you have to be active in your little confined isolation. If you're not active, you are going to be sedentary, then it's going to create problems. So if you're doing all of that, then usually the patients are not having problems. Or what is happening, that okay, I'm doing all that, 5th, 6th day, my pulse oximeter starts showing a little problem. I immediately call up my doctor. That, see, it was 95, 96, 97, it's become like 93, 94. I'm a little worried. We need to get a CT scan of the chest, and depending on the score of that, we put you on steroids.
Okay. We're getting lots of questions here.
You know, it's already 6:20. We continue.
I know. I know we were supposed to do about half an hour.
OPD begins at 6:30, but I'm more than happy to accommodate another 5-10 minutes. It's okay.
Okay, so we'll do another 5 minutes and then we'll wrap it up. We will be coming back live with Dr. Glossy for the rest of this week. We have decided that CII IWN wants to make Dr. Glossy available to everybody. So you can keep your questions coming, get them prepared. If you haven't been answered to today, we will take them again tomorrow. Same time, 5:30 to about 6:15 for the rest of this week. So Tuesday, Wednesday, Thursday, Friday, we'll be live with Dr. Glossy. We'll just do 2 more questions and wrap it up today. Okay?
Yes, please.
Okay. If by the 5th day after testing negative, the person is recovering and the throat pain is 50% better, do we still need to get a scan?
On the 5th day of your recovery, your throat pain is better. So for throat pain, we don't need a scan. Throat pain is more or less a symptom which is going to get over with time. You have to do betadine and saline gargles, take hot liquids and do steam. That is what will help. But please, here I want to emphasize on steam, that do not take very hot steam. You have to take regular steam. What steam we were taking all for the regular viral. Don't burn yourself up. You know, thinking that you'll kill the virus. It won't be killed. It is only killed by heat in the laboratory and not otherwise.
Okay. If my RT-PCR comes negative, what should I do to get my smell and taste back? Is it normal symptom post-viral? Like normal, and how long will it take?
So viral in some patients has caused loss of smell, anosmia and distaste, which has persisted in some patients, though a small percentage, but in some patients till about 3 to 6 months also. It will come back slowly. But it is nothing to be worried about. Yes, it is annoying. You cannot taste anything, but it's okay. You will. It can take time. So have patience. Steaming might help. Taking hot fluids might help, because olfactory cells, the ones in the nasal cavity, are very, very small. So they end up there in the brain, are very tiny, so they can get affected. And once they get affected, it takes time for them to recover back. It can take even up to 3 months, and some patients have taken up to 6 months to get their taste and smell back.
Okay, so there is hope. Everybody will we'll get back to, normal again. So just a quick question. If somebody tests positive, and this is the last question for the day, if somebody tests positive and you have kids at home, what do you do?
You have to isolate yourself. We all know that this virus is affecting kids also. We are fortunate that kids are not having it in a severe way, but fingers crossed, we don't want to see that at all. Kids, you have to, the same protocol follows. You have to be isolated, your kids have to be separate. The other caretaker has to come and take care. You cannot take care at all. You have to isolate, you have to take care of yourself. Kids will fight it out, but if your child also develops, suppose you have, and on day second, third, fourth, your child also develops, then you take the child with you in isolation. Both mama and baby can be together. It's a happy bonding time, doesn't matter.
Wonderful. Wonderful. Dr. Glossy, it has been very, very insightful, and really appreciate you taking so many questions today. And we really look forward to having you back with us. Need of the hour is the initiative launched by CII-IWN. We will be giving access to doctors. We will be giving home protocols, demonstrations on how to work the oxygen machine, oxygen concentrator, cylinders, and we will have wonderful, wonderful doctors next few weeks coming on board. So look forward to everybody joining us at 5:30 daily, Monday to Friday, our Zoom platform, and as well as FB.
Thank you so much.
Big thank you to everybody who joined in, and we hope.
I can see a lot of questions being unanswered. I am really, please, we will be answering these questions tomorrow.
Tomorrow.
Log in. Yeah, tomorrow do log in, and we'll be here available 5:30 to 6 o'clock every day till Friday, right, Bhavna?
Yes, till Friday, every single day we will be happy.
Remember the 5 pointers that Bhavna is going to tell in the end. The 5 things if you are feeling unwell. Bhavna, please emphasize one last time.
She's testing me how well I was paying attention to her, but I've written it down, Bossy. So the first thing, if you're not feeling well, you're going to isolate. You're not going to panic. You are going to check your fever. You are going to do your pulse oximeter, and then you are going to hydrate and call your doctor.
Yes, perfect.
Thank you very much, madam.
Thank you so much for helping out everyone.
No, it's my pleasure.
Thank
you so much, everyone, for joining in, and please
thank you
at 5:30.
See you guys tomorrow, same time. Thank you.
Thank you.